Normal bacterial flora. Bacteria or fungi may occur naturally in or on hosts. Normal flora. Asterisk see other Quizlet asterisk. Colonization. Presence of organisms at a site that does not cause disease. Sterile body sites. Bloodstream, bone, cerebrospinal fluid, lower morphology, 4 basic shapes. Bacilli, rods cocci, round, oval pleomorphic, display different shape spiral, S-shaped, curved rods. Morphology, organization. Chains, clusters, pairs. Steps involved in gram staining. Blank underscore of samples from the site of infection provides a rapid diagnostic tool of the preliminary diagnosis and morphology of the organism. Microscopic examination. Isolation of the pathogen by blank is the most definitive method available for the diagnosis and treatment of infection. Culture. Cultures obtain specimen to submit for analysis in the microbiology laboratory before initiation of antibiotic therapy. Gram-positive bacteria, facultative anaerobic/aerobic gram-positive cocci clusters. Staphylococcus spp. Coagulase, S. aureus coagulase, S. epidermis, S. hemolyticus, S. hominis, S. saprophyticus. Gram-positive bacteria, facultative anaerobic/aerobic gram-positive cocci pairs. Streptococcus pneumoniae. Gram-positive bacteria, facultative anaerobic/aerobic gram-positive cocci pairs and chains. Enterococcus faecium, Enterococcus faecalis, Enterococcus cassili-flavus, Enterococcus falciparum. Gram-positive bacteria, facultative anaerobic/aerobic gram-positive cocci chains. Gram-positive bacteria, aerobic gram-positive bacilli. Bacillus anthracis Listeria monocytogenes Corynebacterium diphtheria nocardia spp. Corynebacterium haechium. Gram-positive bacteria, anaerobic gram-positive cocci. Peptostreptococcus spp. Gram-positive bacteria, anaerobic gram-positive bacilli. Actinomyces israelii, Clostridium perfringens, Clostridium difficile, Clostridium tetani acnes. Gram-negative bacteria, gram-negative bacilli, lactose fermentation, oxidase positive, Enterobacterales. Gram-negative bacteria, aerobic bacilli. Gram-negative bacteria, anaerobic bacilli. Bacteroides spp. Prevotella spp. Fusobacterium spp. Gram-negative bacteria, cocci. Moraxella cataralis, Neisseria gonorrhoeae, Neisseria meningitatis. Gram-negative bacteria, anaerobic cocci. Veillonella spp. Gram-negative bacteria, anaerobic bacilli. Bacteroides fragilis, Bacteroides spp. Prevotella spp. Fusobacterium spp. Atypical bacteria. Chlamydophila pneumoniae, Chlamydia trachomatis, Legionella, Neumophilia, Mycoplasma pneumoniae. Common pathogenic organisms. Asterisk, see other corselet asterisk. Minimum inhibitory concentration. Lowest antimicrobial concentration that prevents visible growth of an organism within about 24 hours of incubation. MIC breakpoints. MIC values that predict probability of treatment success in patient-used and clinical and individual patient care. MIC breakpoints, susceptible. Likely to eradicate organisms using the standard antimicrobial doses. MIC breakpoints, intermediate. Likely to eradicate organisms using maximum antimicrobial doses or if the antimicrobial concentrates at the site of the infection. MIC breakpoints, resistant. The organism is not inhibited by standard antimicrobial doses, likely leading to therapeutic failure and/or mechanisms of resistance may be present, and clinical efficacy has not been demonstrated. Who established the MIC breakpoints? The Clinical and Laboratory Standards Institute. Susceptibility Report. Used to de-escalate target therapy source, blood results, coagulase negative Staphylococcus. Bactericidal. Antibiotics kill susceptible bacteria, and do not require the aid of host defenses. Antibiotics that are bactericidal. aminoglycosides carbapenems cephalosporins monobactams penicillins daptomycin fluoroquinolones metronidazole polymyxin evancomycin oritavancin. Bacteriostatic. Antibiotics inhibit susceptible bacteria replication without killing the organism, and require the aid of host defenses to clear tissues of the infecting microorganism. Antibiotics that are bacteriostatic. Chloramphenicol, clindamycin, glycyclines, linezolid, macrolides, nitrofurantoin, sulfonamides, tetracyclines. Empiric. Initiation of drugs prior to identification of causative organism. Directed. Drugs targeting causative organism upon culture results. Prophylaxis. Administration of drugs to prevent or reduce risk of infection. De-escalation. Process of streamlining antimicrobial therapy from broad spectrum to narrow spectrum based on the patient's culture results. Antimicrobial stewardship. Effort to measure and improve how antibiotics are prescribed by clinicians and used by patients. Natural penicillins dosage forms and brand names. Penicillin G brand, Serpin dosage form, IV penicillin G procaine brand, Vicillin dosage form, IM penicillin G benzalthine brand, Bicillin LA dosage form, IM penicillin G procaine, and benzalthine brand, Bicillin CR dosage form, IM penicillin VK brand, Pen VK. VTAIDS dosage form, PO. Natural penicillin spectrum of activity. Natural penicillins MOA. Inhibit cell wall synthesis by binding to penicillin binding protein. What is another name for penicillinase-resistant penicillins? Anti-staphylococcal penicillins. Penicillinase-resistant penicillins dosage forms and brand names. Methicillin, greater than first agent synthesized in this group. No longer available in US due to higher incidence of interstitial nephritis. Oxacillin brand, Bactocil dosage form, IV nafcillin brand, Unipin, Nafcil dosage form, IV dicloxamine brand, Dinalpin, Diclosol, Diazyl dosage form, PO. Penicillinase-resistant penicillin spectrum of activity. Penicillinase-resistant penicillins MOA. Inhibit cell wall synthesis by binding to penicillin binding protein. Aminopenicillins dosage forms and brand names. Ampicillin brand, Principin dosage form, IV, PO. Amoxicillin brand, Amoxil, Trimox, Moxilin dosage form, PO. Aminopenicillin spectrum of activity. Aminopenicillins MOA. Inhibit cell wall synthesis by binding to penicillin binding protein. B-lactam/B-lactamase inhibitor combinations, dosage forms and brand names. Amoxicillin/clavulanic acid brand, augmentin dosage form, PO ampicillin/sulbactam brand, anacin dosage form, IV piperacillin/tazobactam brand, zosyn dosage form, IV sulbactam/durlobactam brand, Xalcuro dosage form, IV. B-lactam/B-lactamase inhibitor combination spectrum of activity, ampicillin/sulbactam and amoxicillin/clavulanic acid. B-lactam/B-lactamase inhibitor combination spectrum of activity, ticarcillin/clavulanic acid and piperacillin/tazobactam. B-lactam/B-lactamase inhibitor combinations MOA. B-lactamase inhibitor binds to B-lactamase to prevent breakdown of the antibiotic. First-generation cephalosporins background. Good gram-positive activity and limited gram-negative activity. First-generation cephalosporins dosage forms and brand names. Cefazolin brand, ANSF dosage form, IV, IM cephalexin brand, Keflex dosage form, PO cefadroxil brand, Durisv dosage form, PO cephradine brand, Veloz dosage form, PO cephalothrin brand, Keflin dosage form, IV, IM cefapirin brand, Cefadil dosage form, IV, IM. First-generation cephalosporins quick trick for recalling names. Many first-generation cephalosporins have pH in their names, therefore you must have a pH. D in pharmacology. Cephalexin, cephradine, cefapirin, cephalethrin exceptions, cefazolin, cefadroxil, but don't let that phase you, it's just a fad. First-generation cephalosporin spectrum of activity. First-generation cephalosporins MOA. Inhibit cell wall synthesis by binding to penicillin binding protein. Second-generation cephalosporins background. Two groups: true cephalosporins and cefamycins with enhanced gene activity. Second-generation cephalosporins dosage forms and brand names. Second-generation cephalosporins quick trick for recalling names. Second-generation cephalosporin spectrum of activity. Second-generation cephalosporins MOA. Inhibit cell wall synthesis by binding to penicillin binding protein. Third-generation cephalosporins background. Enhanced gene activity compared to first and 2nd generations. Usage significant risk factor for production. Third-generation cephalosporins dosage forms and brand names. Third-generation cephalosporins. Quick trick for recalling names. Most of the third-generation cephalosporins have a T in their name. The T is for TRI, and after you drive your car you might have to fix it. Greater than ceftriaxone, ceftazidime, cefotoxime, ceftizoxime, ceftibiprole, ceftatorin, cefixime. Exceptions: cefiperazone, cepodoxime, cefdiniir. Third-generation cephalosporin. Spectrum of activity. Third-generation cephalosporins. MOA. Inhibit cell wall synthesis by binding to penicillin binding protein. Fourth-generation cephalosporins. Background. Broadest spectrum of all the cephalosporins. Fourth-generation cephalosporins. Dosage forms and brand names. Cefepime brand, Maxipime. Dosage form, IV. Fourth-generation cephalosporin. Spectrum of activity. Fourth-generation cephalosporins. MOA. Inhibit cell wall synthesis by binding to penicillin binding protein. Anti-MRSA cephalosporins. Background. A prodrug with extended gram-positive spectrum. Anti-MRSA cephalosporins. Dosage forms and brand names. Ceftaroline brand, Tiflaro. Dosage form, IV. Anti-MRSA cephalosporins. Spectrum of activity. Anti-MRSA cephalosporins. MOA. Inhibit cell wall synthesis by binding to penicillin binding protein. Cephalosporin/B-lactamase inhibitor combination. Background. Ceftolozane is a novel cephalosporin with potent P. aeruginosa activity. Cephalosporin/B-lactamase inhibitor combination. Dosage forms and brand names. Ceftazidime/avibactam brand, Avicaz. Dosage form, IV. Ceftolozane/tazobactam brand, Zerbaxa. Dosage form, IV. Cephalosporin/B-lactamase inhibitor combination. Spectrum of activity. Cephalosporin/B-lactamase inhibitor combination. MOA. Cephalosporins inhibit cell wall synthesis by binding to PBP and the BLI, inactivates some B-lactamases and protects the cephalosporin from degradation by certain B-lactamases. Cetapher. Dosage form and brand name. Chifetaricol brand, Fitroya. Dosage form, IV. Cetapher. Spectrum of activity. Gram-positive, no clinically relevant in vitro activity. Gram-negative, Abomani, Enterobacter-Rales, P. aeruginosa, MDRS multifilia. Bottom line, reserved for MDRO and carbapenem-resistant GNR unearables, no clinically relevant in vitro activity. acidophore MOA. Carbapenem's background. Enhanced gram-positive, gram-negative and anaerobic coverage, very broad spectrum. Gorillas, but ertapenem is the gorilla without the APE spectrum of activity, or equal exception for ertapenem compared to other agents in this class. Carbapenem's dosage forms and brand names. Imipenem cilastatin brand, Promexin dosage form, IV meropenem brand, Mirum dosage form, IV ertapenem brand, Invans dosage form, IV doripenem brand, Doribax dosage form, IV. Carbapenem's spectrum of activity. Carbapenem's MOA. Inhibits cell wall synthesis by binding to penicillin binding protein. Carbapenem plus BLI combination dosage forms and brand names. Meropenem/vaporbactam brand, Vabomere dosage form, IV imipenem/cilastatin/relebactam brand, Recarbrio dosage form, IV. Carbapenem plus BLI combination nomenclature trick. Recarbrio Re, Carb, Rio. Carbapenem plus BLI combination spectrum of activity. All of the bacteria noted above in carbapenem section, but the addition of the novel BLI, vaporbactam, enhances the spectrum of activity reserved for multi-drug-resistant organisms, particularly if carbapenem-resistant Enterobacteriaceae and carbapenem-resistant P. aeruginosa S. Carbapenem plus BLI combination MOA. Carbapenem inhibits cell wall synthesis by binding to PBP and the BLI inactivates some B lactamases and protects the cephalosporin from degradation by certain B lactamases. Monobactam background. Only active against gram-negative aerobic bacteria. Monobactam dosage form and brand name. Aztreonam brand, Azactam dosage form, IV. Monobactam spectrum of activity. Monobactam MOA. Inhibits cell wall synthesis by binding to penicillin binding protein. Aminoglycosides dosage forms and brand names. Gentamicin brand, Garamicin dosage form, IV. Oftobramycin brand, Nepsin, Toby, Tebrix dosage form, IV. Neb, Ophthomycin brand, Omicin dosage form, IV. Neplazomycin brand, Zemdri dosage form, IV. Aminoglycosides spectrum of activity. Aminoglycosides MOA. Irreversibly bind to bacteria 30S ribosomal unit leading to disruption in protein synthesis. Plazomycin background. Approved June 2018. Plazomycin dosage form and brand name. Plazomycin brand, Zemdry dosage form, IV. Plasmicin spectrum of activity. Macrolides dosage forms and name brand. Erythromycin brand, ES, Erytab, Eric, Erised, Eripe dosage form, IV, PO, topical, oft-clarithromycin brand, Bioxin, Bioxin XL dosage form, PO azithromycin brand, Zithromax, SPAC, Tripac, Zmex dosage form, IV, PO, oft-phytoxamycin brand, Deficit dosage form, PO. Macrolide spectrum of activity. Macrolides MOA. E, C, A, reversibly bind to bacteria 50S ribosomal unit leading to disruption of protein synthesis. F, inhibits RNA synthesis by binding to RNA polymerases. Fluoroquinolones dosage forms and brand names. Fluoroquinolones traditional FQ spectrum of activity. Fluoroquinolones MOA. Inhibits bacteria DNA synthesis by interfering with DNA gyrase. Dilafloxacin anti-MRSA-FQ spectrum of activity. Dilafloxacin anti-MRSA-FQ MOA. Inhibits bacteria DNA synthesis by interfering with DNA gyrase. Tetracyclines dosage forms and brand names. Tetracycline brand, Sumicin dosage form, Doxycycline brand, Vibromycin, Audixa, Dorix, Monodox, Vibratabs dosage form, IV, monocycline brand, Minocin, Dinocin, Solodin dosage form, IV, Ravacicline brand, Xarava dosage form, IV Ometacycline brand, Nuzera dosage form, IV, PO. Tetracycline spectrum of activity. Tetracyclines MOA. Bind reversibly to 30S bacteria ribosomal unit leading to inhibition of protein synthesis. Glycylcyclines dosage form and name brand. Tigecycline brand, Tigecyl dosage form, IV. Glycylcycline spectrum of activity. Glycylcyclines MOA. Bind reversibly to the 30S bacteria ribosomal unit leading to inhibition of protein synthesis. Polymyxins dosage forms and name brands. Polymyxin B brand, Polytrim dosage form, IV, Oticolus dimethyate sodium, Polymyxin E brand, Colistin, Colimycin M dosage form, IV, PO, Cystic fibrosis nebulized SOLN, Otic. Polymyxin spectrum activity. Gram-negative, P. aeruginosa, Abomani, Enterobacteriales spp. No gram-positive or anaerobes. Polymyxins MOA. Cholestymic is a prodrug that is hydrolyzed to colchicine. Penetrates and disrupts lipopolysaccharides and phospholipids in the outer cell membrane of gram-negative bacteria. Nitrofurantoin dosage forms and brand names. Nitrofurantoin brand, Macrobid dosage form, PO. Nitrofurantoin spectrum of activity. Gram-positive, S. aureus, S. epidermidis, S. saprophyticus, S. acalacti, E. faecalis, E. facetium. Gram-negative, E. coli, Enterobacter spp, Citrobacter spp, Klebsiella spp. Nitrofurantoin MOA. Several that are not fully understood. Reduced by bacteria enzymes to nitrofurans, the highly reduced, reactive intermediate binds to ribosomal proteins inhibiting protein synthesis, inhibits several bacterial enzymes, and may cause damage to bacteria DNA. Sulfonamide dosage form and brand name. Trimethoprim sulfamethoxazole brand, Bactrim, Septra dosage form, IV, PO. Sulfonamide spectrum activity. Sulfonamide MOA. Synergistically inhibit bacterial growth by interfering with folic acid synthesis. TMP inhibits dihydrofolate reductase. SMX inhibits dihydrooctoroate synthesis and dihydrofolate reductase. Glycopeptides and lipoglycopeptides short-acting dosage forms and brand names. Vancomycin brand, Vancomycin, Fiervanc dosage form, IV, PO. Telavincin brand, Vibrative dosage form, IV. Glycopeptides and lipoglycopeptides short-acting spectrum of activity. Glycopeptides and lipoglycopeptides short-acting MOA. Inhibits bacteria cell wall synthesis by irreversibly binding to dealanine residues. Glycopeptides and lipoglycopeptides long-acting dosage forms and brand names. Dalbavancin brand, Dalvance dosage form, IV. Oritavancin brand, Orboctive, Chemisa dosage form, IV. Glycopeptides and lipoglycopeptides long-acting spectrum of activity. NO gram-negatives gram-positives, Staphylococcus spp. Streptococcus spp, Enterococcus spp. Anaerobes, Cutibacterium spp, Clostridium spp, Peptostreptococcus spp, Bacillus spp, Corynebacterium spp, Micrococcus spp, Actinomyces spp. Glycopeptides and lipoglycopeptides long-acting MOA. Oxazolidinone dosage forms and brand names. Linezolid brand, Xivox dosage form, IV, PO. Tadezolid brand, Civextra dosage form, IV, PO. Oxazolidinone spectrum of activity. NO gram-negatives GP aerobes, Staphylococcus spp. Streptococcus spp, Enterococcus spp. Corynebacterium spp, Listeria monocytogenes GP anaerobes, Actinomyces spp, Clostridium spp, Peptostreptococcus spp, C. acnes, Lactobacillus spp. Oxazolidinone MOA. Reversibly binds to 50S ribosome at interface with the 30S unit, thereby prevents formation of 70S initiation complex. Lipopeptides dosage form and brand name. Daptomycin brand, Cubicin, Cubicin or F dosage form, IV. Lipopeptide spectrum of activity. NO gram-negatives gram-positive aerobes, Staphylococcus spp. Streptococcus spp, Enterococcus spp. Corynebacterium spp, Listeria monocytogenes gram-positive anaerobes, Actinomyces spp, Clostridium spp, Peptostreptococcus spp, C. acnes. Lipopeptides MOA. Disrupts and irreversibly binds to the bacteria's cell membrane, forming with the lipophilic tail, leading to rapid cell death. Clindamycin dosage form and brand name. Clindamycin brand, Cleocin dosage form, IV, PO, topical. Clindamycin spectrum of activity. Clindamycin MOA. Reversibly bind to 50S subunit of the bacteria ribosomal unit, leading to inhibition of protein synthesis. 5-nitroimidazoles dosage form and brand name. Metronidazole brand, Flagyl dosage form, IV, PO, topical, vaginal. 5-nitroimidazoles spectrum of activity. Five-nitroimidazoles MOA. Inactive prodrug diffuses across cell membrane, and the nitro group is reduced by bacterial enzymes to radical anions that may interfere with bacterial DNA synthesis. Phosphomycin dosage form and brand name. Phosphomycin brand, mineral dosage form, PO, IV. Phosphomycin spectrum of activity. Gram-positive, Enterococcus spp. S. aureus S. pneumoniae gram-negative, Enterobacteriales P. aeruginosa and meningitis. Phosphomycin MOA. Interferes with bacterial cell wall synthesis by inhibiting enzyme enolpyruvyl transferase. Rifampicin's dosage form and brand name. Rifampin brand, Rifampin dosage form, IV, PO. Rifampicin spectrum of activity. Gram-positive, S. aureus, coagulase negative Staphylococcus spp, Streptococcus spp. Gram-negative, N. meningitis, H. influenzae, E. coli ie acid fast, Mycobacterium tuberculosis, other Mycobacterium spp. Atypicals, Legionella neomophilia anaerobes, C. difficile. Brifamicins MOA. RNA synthesis by binding to base subunit of bacteria DNA-dependent RNA polymerase. Rifamycin's clinical use as combination therapy. Tuberculosis, non-tuberculosis, mycobacterium infection, staphylococcal infections against biofilms and meningitis, post-exposure prophylaxis for close contacts. Bacteria resistance. Pathogens of concern: Ephesium S. aureus, K. pneumonia, A. Bomani, P. aeruginosa, Enterobacter spp. Mechanism of antibiotic resistance. Resistance mechanisms found in select organisms: gram-positive S. aureus. Resistance mechanisms found in select organisms: gram-positive S. pneumoniae. Penicillin-resistant S. pneumoniae, alteration in PBP, multi-drug resistant, alteration in PBP and target site leading to resistance to several classes of medications. Resistance mechanisms found in select organisms: gram-positive Enterococcus spp. Resistance mechanisms found in select organisms: gram-negative extended spectrum lactomases. Resistance mechanisms found in select organisms: gram-negative FCB lactomases.